Good evening, listeners. A warm welcome to Views on Health. Back with us on the program tonight is Dr. Duleepa Baranage, consultant eye surgeon, National Hospital, Kandy. Welcome back to SLBC and the program. A pleasure to have you with us again, Doctor. And we are going to continue with causes of blindness, with the focus being on diabetes as a cause. Without any further ado, over to you, Doctor.
Yeah, thanks, Fatima, again for the invitation and having me back in the program. So last week we talked about the commonest causes of blindness. We talked about cataract. We talked about glaucoma, one being number one and number two. Third commonest cause, well, as I told you, worldwide developed countries probably itching towards age-related macular degeneration, which is a problem in Sri Lanka as well, yes. But in the Sri Lankan context, being a developing country, the third most commonest would be diabetes, and its effects on the eye. We call it diabetic retinopathy, right? So, which is again a very devastating condition. Now, diabetes is again another silent killer, just like glaucoma. Diabetes, the difference in glaucoma and diabetes, probably diabetes is a silent killer in many ways. Not only does it kill the eye, it also kills your kidney, your heart, your nerves and all. So when you come to the eye, of course, it's diabetes causes microvascular diseases. So with the eye, it can affect the kidney, heart, and the nerves, right? Neurons as well. So the recent, now let's take about the prevalence. I was listening to one of the senior endocrinologists a couple of weeks back. So 1 out of 5, it's 20% of our population are already diabetic. So you meet 5 people, 1 is a diabetic, right? And then according to recent research, 33%, or maybe, there is 1 out of 3 diabetics will have an eye problem, right? So 3 diabetics, you meet 3 diabetics, 1 will have an eye problem. It can be dangerous, it can be not so dangerous, but still they are embarking on treading in dangerous waters, I would say, right? So let's say you meet, if we do the math correctly, if you meet 15 people out there, 1 will have an eye problem, right? Because of diabetes, right? So that's pretty alarming, right? So that's how prevalent it is. How diabetes will affect eyes? Okay, so from least to worst, it can affect your eyesight, which can be offset with glasses alone, right? So if you have very high blood sugars today and then tomorrow it goes down again, so if there's fluctuation of blood sugars, these sugar particles will affect your lens and your the fluid inside the eye, and your refractive power can go haywire, right? So you will have to use glasses, but again it's transient. Once you control your diabetes, your vision can go back to normal, right? Or else, even if it doesn't go back to normal, with glasses alone you can fully correct it. Then of course, going back in the structure, lenses, yes, as I told you last week, you have this age-related cataract, right? In diabetes, they get cataracts much more earlier than the normal population, right? Let's say normal population get a cataract at 60, they will get it at 50, right? And the consistency of the cataract is also a bit different to the age-related consistency, and the cataract surgery is also a bit tricky than the normal population. The complication profile rises a bit. So if you have a cataract, if you're diabetic, if you have cataract, it's best to get it done a bit earlier, as soon as you feel it, as soon as you feel its effect. Then, as I told you last week, glaucoma, yes, there's a slight increase of glaucoma in diabetics. And then comes the more dangerous problems, the retinopathies. You get diabetic retinopathy and diabetic macular edema. Now, that is where my specialty comes into play. I'm an eye surgeon. I am a specialist in vitreoretina, that is retina and the vitreous. I'm a vitreoretina surgeon. So we tend to attract a lot of diabetic patients with so much of complications. Okay, so one thing what happens is it can bleed inside the eye. As I told you, it's a silent killer. So you will realize once it has already bled inside the eye. Then of course we have to go in, do a big surgery to clear out the blood, do laser injections and all. And even after that, we might not be able to regain the best vision he or she had. So to prevent that, what we do is we can do laser to prevent bleeding. So that's where the proper follow-ups and the reviews come in. And then of course we have diabetic macular edema. If that happens, of course your vision will transiently go down. Then of course we have to inject the eye with some drugs to get the vision back to what it was. So those are probably the main ways that diabetes can affect your eyes.
Speaking of the internal bleeding, A, how does it happen? And B, when it does happen, will the person know, he or she know that it's bleeding? Will there be a visible sign like a blood clot or some sort of reddishness in the eye, or will it be something that is not visible?
Yes.
That only a doctor can know? But
yes, very good. So I'll start off with the question number 2, right, and then come to 1, because 1 is more technical, explanation. Okay, 2. That's why I told it's a silent killer, right? So that's why we ask every diabetic to show their eyes at least yearly, right? So every year you have to get your eyes checked. Now, if you go to an endocrinologist, they will of course refer you to an eye surgeon every year, right? If you go to a GPS, right? So it's a responsibility of the patient as well as the doctor who is looking after the diabetic patient to actually refer the patients at least every year to an eye surgeon. So we have a look and see whether there is a tendency to bleed. And then if there's a tendency to bleed, we explain the patient, ask them to better, tightly control diabetes. And if there are treatment modalities at that stage, yes, we can do the treatment. But if it's not up to that level, we ask them to come back in maybe 6 months or maybe 3 months. We ask them to come back a bit earlier, right? So if we do the proper treatment at the proper time, yes, we can prevent bleeding entirely. So we are treating actually a good eye, where the patient's perspective, it's a good eye because they will have good vision. We are treating actually a good vision according to eye according to the patient, but the back of the eye is not looking good. That's why we are treating. So that's why when they will not actually realize until it has bled inside the eye, which then of course might warrant a surgery itself. To prevent bleeding only, we'll be treating. So then of course we'll go back to question number 1, how this happens. So as I told you, it's a microvascular, so it's a disease which affects your small blood vessels. Diabetes affects your small blood vessels, not only in the eye, kidney, heart, everything, it's the same story. So what happens is your oxygenation to the eye is impaired. Your blood vessels, let's say, thins out, right? In lay term, I'll try to explain this in lay term. So, it thins out, your blood vessels thin out, and the oxygen now supply is compromised to maintain all that, nerves. So what happens? These nerve fibers inside the eye will be asking for oxygen, right? They will be, making riots. Okay, we want oxygen. So then the body will realize, okay, they're asking for something. So as a patchwork, right? What they do is they try to provide oxygen by sprouting out new vessels, right? So this is a temporary measure just to subdue all those, shouting neurons. So once these new vessels sprout out, these new vessels are not sustainable at all, right? Now when we see the eye, we can see new vessels. The patient will not realize they are, So when we see new vessels, we know that the oxygen is compromised to the eye now. And now, as a reaction to the compromise, the body is trying to give new oxygen to the neurons. So that's why then only we know that there something is going wrong. Okay, so these new vessels are fragile. They burst and they bleed, and the whole thing gets flooded. So that's where you get bleeding and everything goes black. When of course it bleeds, you will see if there's a floater, a cloudy eye. For everything is kind of falling apart, and you will suddenly see a black curtain kind of pulling across your visual field. Right? So then of course we don't have anything, we can't see the back of the eye to treat. So once we see new vessels, we know that the eye is now compromised. What we do is we laser the eye, and what we do in laser is we actually kill off part of the retina. Right, so now let's say we have 1,000 nerves in the eye. What we do is we kill off 500 not unwanted but less important nerves, so that in the hope that whatever the blood which is being currently supplied will be enough to supply that 500 which is left. So then there will be no vessels sprouting out, because there's no need to resupply oxygen or increase the oxygen supply, and whatever the compromised blood supply is more than enough to maintain that 500. Okay, then if still there are new vessels coming in, we can kind of do more laser and get rid of another 250, making sure that only 250. But of course if we take out the remaining 250 also, the patient will of course go blind. So we only keep what is most important. The acute vision will be left alone, but the more let's say the peripheral vision will be compromised because after the laser. But we are doing laser to prevent something very bad happening to the eye. So if we do a good laser, and of course after explaining the patient, if the patient also controls their diabetes, then we can stop it at that stage, and we can altogether prevent a big surgery and further deterioration of the vision altogether. But we get sometimes especially in young diabetes, still their diabetes is not under control. Now all these we do are temporary measures. Still if the diabetes is not under control, bleeding will be will happen, of course, and because the oxygen which is so compromised that we will not be able to maintain even that 250. So we can't laser off the remaining 250. So then of course we'll have to go in, do surgery, or maybe give an injection to control the there are several modalities which we'll have to resort to.
So in other words, doctor, like even your colleagues practicing other disciplines of medicine, as they say, diabetes has to be controlled, and they all emphasize the need to do so, emphasize the patients, the need to do so. So obviously you expect the patient to follow medical advice and adjust their lifestyles accordingly in diet, exercise, and of course take medication
Yes.
as they have to take, not stop suddenly and then start again.
Yes.
I think that some patients are want to do, which creates a
Yes.
problem again, health problem. So putting all that together, so you obviously stress this to the patients.
Yes, of course, because the single most effective treatment, whether it comes to eyes, kidneys, heart, nerves, whatever, the single most important treatment modality is controlling your diabetes. Without controlling your diabetes, whatever we do will not be a long-lasting, will not have a long-lasting effect. We do laser, as I told you, we give injections. Those are all temporary. For the time being, we are settling the eye to prevent it going to the next stage. But we can't stop it going to the next stage unless you stop your diabetes. So diabetes, that's why I told you, is a silent killer, and the main problem is diabetes itself. So the doctor who is looking after your diabetes has a very big role to play. The most important role to be played is by the diabetic doctor, right? So he or she has a big role to play. He or she has to control these patients diabetes, and of course it's although they advise the patient, of course it's up to the patient to three things: your medication, your diet, and your exercise. So that's what the diabetic doctor will always tell you. So all these three, you have to realize how bad it is, and then you have to maintain those in order to control your eye, kidney, heart, nerves, any other organ. If you don't control your diabetes, whatever we do will not be of any good.
Doctor, there are so many children today affected
Yes, I know.
by diabetes.
That's the problem.
So how does that, I mean, they have the entire future before them.
Exactly. So yeah, sorry, I forgot to mention this now. I told you about diabetes retinopathy, how diabetes affects the eye. Now, the longer you have diabetes, the more chances it can affect your eyes drastically, very dangerously. The tendency of bleeding will be increased the longer you have diabetes. So if you're a childhood diabetic, of course you have, as you told, their entire future in front of them. So inevitably they will have some diabetic changes during their lifetime, diabetic changes in the eye, right, during their lifetime, because it's in 30, 40, 50 years to go, right? So they will of course end up having diabetic retinopathies. So that's why the earlier you detect them, the earlier we treat them, we can control it to a certain extent. And of course with their diabetes control, yes. So I think I mentioned this last week, because of post COVID era, we see a lot of diabetes, very bad diabetic retinopathies, purely because of this lack of awareness, and of course lack of treatment during those days. The patient didn't have proper treatment, no proper follow-up, and they were just enjoying life probably at home, and then of course they turn up having bad vision, which is probably beyond recovery. Still, there are, as I told you, there are surgical options which can halt the progression, but the chances of them having their best vision might be long gone. But at least we can, if at least we can stop it at that point, or at least gain some vision. Yes, there are, just because you're blind in one eye doesn't mean that all hope is lost. There are surgical modalities. That's what my specialty comes into play, right? We go in, we do surgeries. As soon as we see those patients, we try to go in very early, right? Especially in the young, because it's very aggressive in the young. We go in early, try to hamper the progression, and then come out having a better result. So yes, young diabetes is becoming a huge burden, and public awareness should be made for those.
Doctor, now this treatment, hopefully it will restore vision to an extent, or would you think that if they do not follow proper medical advice and they neglect taking their medication, doing what they shouldn't do, can it come back? Can there be some sort of regression?
Yes to both. Now, yes, so there can be a improvement, probably marked improvement. Now, let's say it has just bled, and we go in very early. They can actually get their vision back, to what it was. So it's a spectrum. Now, what I normally tell patients, because you don't have to have high hopes, when they come walking in with loss of vision, now we treat before they lose their vision, right? I told you we do laser, we inject and all. That is before they lose their vision. Now that window has gone already. Now they are coming with a visual impairment. What I normally tell patients is, my main idea is to at least maintain that vision. So I go in the eye in the hope that I will be able to stop it at that stage. Still I might fail, right? But what I can 100% guarantee, I can 100% say is that if I don't treat, you will go blind. That is for sure. But if I treat, I don't know whether I can stop it at that, or you can even improve your vision, or it can go down. We don't know. But surgery or whatever the treatment modality is the only hope you have. If you don't do it, it's pretty sure that you are going to lose your vision altogether. So that's how I normally explain it. The patient also has a small idea on what they are doing, because they will not have high expectations, high hopes. So after surgery they know what to expect, and if they get good vision, they will be very happy. And yes, again, the second thing I normally tell is, go see your diabetic doctor, show these to them, tell that you have to get your diabetes under control, because whatever I do now, you, even if you get the best vision, it can just be, gone, blown away purely because of your lack of diabetes control. So you don't control your diabetes, it's always a very, very bad road to, walk in.
So we do have this quite a high population, or rather percentage of our population being affected with these causes for blindness.
Yeah.
And across the board, it could be males or females, it could be children as well, plus the young adults, middle-aged, going into the elderly.
Yes.
Though you explained it the first time around last week that most of the causes are seen in the elderly.
Yes.
From what we know, even younger people are affected.
Yes.
So it is not the best thing that we would like to have for our population. So what sort of advice would you give our listeners out there?
Yes.
To begin with, from a very young age, in order to avoid being diabetic, though diabetes per se is not what you would want to focus on, because as an eye surgeon, you have another area that you're specializing in.
Yes.
But to prevent them
Yes.
coming to you,
Yes.
I mean, you don't want anybody falling sick
Yes,
like
I know,
this.
I know.
What would you advise our listeners?
Yes. So, yeah, as you said, diabetic part would probably better be, probably an endocrinologist would, answer it much more efficiency than me. But yes, what I can say is, if you are a diabetic, make sure that you get your eyes checked by an eye surgeon at least annually. Every year you have to go show the eyes. It's not like other tests. You can gauge your heart function by an ECG. You can gauge your kidney function by some blood test. But you can't go by the vision alone. By the time you realize something is going wrong, it would be a bit too late, right? Because early changes happen to a good eye, a good vision, eye with a good vision. So you will not realize it. Only the eye surgeon looking at the eye will realize that something is going wrong. So to do that, if you are a diabetic, if your friend is a diabetic, if your family member, your relation is a diabetic, tell them to go check their eyes every year with an eye surgeon. And if there are changes, we ask them to come in 6 months. But at least 1 year reviews is a must, a bare minimum. Then, of course, to prevent diabetes is altogether a different topic, to be done by mainly an endocrinologist. It's a burning issue. So that advice I would like to give: if you have diabetes, please go see an eye surgeon at least every year. And if you do the correct treatment at the correct time, you can actually, salvage your vision.
And this is applicable even to the young.
Even to them, anybody. It's not age related, it's about duration of the diabetes, and of course being a diabetic itself.
Thank you, doctor. So now, going on from there, you have your patients, you have done your surgery. Would you have a regular follow-up?
After the surgeries,
Yes, the patients need to come back and see you.
Of course. Now, that's the thing, once you see an eye surgeon for the first time, they will, of course, give you the plan. Okay, you have no diabetic retinopathy, come in 1 year. Or you have this kind of diabetic retinopathy, go show your diabetic doctor and come in 6 months or maybe 3 months. Okay, you have this amount of problem, we need to do laser today, and then come in, So we will not, of course, let go of the patient. The follow-up plan will be laid out to you the first time you come see the eye surgeon. The problem is people come to see the eye surgeon very late during the disease. So then, of course, still we can get, take it from there, but we'll have to, work with our hands bound, So if you come early, we can actually lay down a plan. Okay, this is what your follow-up would be, and, you can adhere to that.
Thank you, doctor, because that is important to know that how you would treat them once they come to you.
Yes.
What sort of follow-up you have.
Even after surgery, there's a huge, follow-up plan. We see them every 3 months or so, and then, of course, every year, if the surgery is all good, we can see them very, not very frequently, but, but still, we will not let go of them. Yes.
There's a question, by the way. Have you come across patients who do not adhere to your follow-up schedule, who may not neglect it and then come maybe much later again?
Of course, many. It's not common to eye itself. It's probably common to any specialty, So people tend to kind of forget about the problem after some time. That's why I emphasize on the fact that just because you're a diabetic, go see a doctor, because go see a eye surgeon. Why? Because people tend to come when they have an eye problem, right? Which can be a bit too late. So that's why I have to emphasize on that even if your vision is good, even if you think that you're okay, go get it certified by your eye surgeon. Okay, your eyes are okay, and get your next review date planned out. So that's why it is important. But as I said, how much we say, probably the patients will not kind of adhere to that. And yes, there are lots of examples where they come up with very bad eyes even after surgery without proper adherence to the plan.
Doctor, I just like to ask you this question. I don't know if it is a fair question. Focusing on causes of blindness, you explained about cataract and glaucoma on the program last week, and this week we're focusing on diabetes. So is there a common denominator? I mean, okay, just take diabetes. If you are diabetic, the chances are that your cataract you're definitely going to get cataract, or you're definitely going to have glaucoma, or if you have cataract, it can also lead to glaucoma if, for whatever reason, from glaucoma to diabetes. Then any tie-up between these causes?
Well, there's no specific correlation. Now, these three are entirely, totally different categories. Now, let's say cataracts. Everybody will get cataract, right? So, everybody will have cataracts. Even a diabetic, being a normal human being, will of course get cataracts when they grow older. But the density of the cataract and the architecture of the cataract is a bit different to a normal person, but that is also variable, right? So glaucoma, yes, so some will get it, some won't. The prevalence is very low, but in diabetics, of course, it can be a bit higher than the normal population, right? So then, of course, diabetes is entirely different. So these three are totally non-related, but diabetics will have exaggerated eye problems when compared to the normal populations. That's why diabetes is a very, very tricky thing to kind of treat, because it's not the disease only limited to the eye. It's a whole body disease where it can affect many organs, and all those effects are exaggerated purely because you're a diabetic. So diabetic control is very important if you're a diabetic. Of course, the other two, it's age related, and if you have glaucoma, it's an entirely separate thing.
Okay, doctor, thank you so much. Time has caught up with us once again, and we would like to have your take-home message.
Yes. So last week I said, a common threshold for your eye check would be by the time you're 40, it's hard for you to read up close. So it's called presbyopia, the disease of the 40s. So then that's a good benchmark to get your eyes checked, just in case, right? If you are not a diabetic, right? Even if you are a normal, if you don't have any comorbidities, no hypertension, anything, still get your eyes checked by an eye surgeon just to see whether you have glaucoma or any other ailments. Of course, if you're a diabetic, at least every year go see your eye surgeon, right? And then they will take it from there. So that's probably my take home message. Thank you for having me in the program, and hoping to see you again soon.
Yes, doctor, thank you so much. We certainly look forward to your participation on the program in the foreseeable future, and thank you for the good advice. And to all our listeners out there, if you are diabetic, please make sure that you get your eyes tested on a regular basis. Thank you to Dr. Duleepa Baranage, consultant eye surgeon, National Hospital Kandy, for being with us on the program and focusing on diabetes as a cause of blindness. Thank you too to Prabhavira Surya for technical assistance. I'm Fatima Razi Kada saying good night, and looking forward to your company next Monday, same time, on Views on Health.